welcome. I am Dr. Gretchen Hawley, a physical therapist and a multiple sclerosis certified specialist, which basically means I specialize in helping people with MS. And the way that I do that is through a very functional approach to physical therapy that includes functional exercise and neuroplasticity. So every month I partner with MS Views and News and we talk about some topic related to MS and physical therapy. It could be walking, it could be analyzing your walking or exercises for walking. It could be spasticity, fatigue. We've done so many at this point, and you can get all of those recordings on their YouTube channel. Today we are going to be talking about pain and sensation in multiple sclerosis. So we're going to talk all about what it is, what all of the different types are, and then also what you can do about it. All right, so as I've mentioned a few times, I partner with MS Views and News for our Moving with MS virtual support group. This is something we've been doing for several years now, possibly even 4 years, which is just so crazy how quickly time is flying by. And a huge thank you to Viatris, who is our supporter for our Moving with MS series. As I mentioned, we're going to be talking about pain and sensation in multiple sclerosis today. I like to combine these two topics because they're so related. Pain is a sensation, and there's so many different types of pain and sensations that can be possible with multiple sclerosis. So I'm going to, Maite from Hollywood, Florida. Thank you for that update. Also, as we dive in, I want you guys to comment if you feel comfortable sharing if you have experienced pain or abnormal sensations from your MS, whether it was just once or if it's something that you experience daily. I'm curious where we all land for everyone who is watching right now, because as you can see from this slide, pain is extremely common, unfortunately, in multiple sclerosis. There are reports saying that 2/3 of people with MS have some level of pain, and over half are affected by chronic pain at some point. And we're going to go into what chronic pain is. I see Bruce says MS hugs weekly. Yes, MS hug is a type of pain for sure. We're going to be talking about that today. So yes, and I see Tamara also says MS hug. Lots of MS huggers. That is a pretty awful symptom, awful type of pain. So before we get into the specific types of sensations and pains, there are two types of pain that relate to how frequently you're feeling it. So there's acute pain and chronic pain. Acute pain is often sudden and inconsistent, and it's typically caused by something. Usually it's an injury, surgery, illness, trauma, like there's a reason for it. Sometimes this can be caused from MS as well. But again, the most important words here, sudden and inconsistent, meaning it doesn't last for a long time. Most times this will go away within even a few days. If it's from an injury, obviously once the injury starts healing, that's when the pain will start to go away. Chronic pain is consistent, and it can be long lasting, which means something different for everyone. It could be several months, it could be several weeks, it could be several years. But the main difference here is that chronic is a long time. It doesn't go away. It can fluctuate. It's not to say that it's always a 10 out of a 10 pain. It might go down to a 4 out of a 10 or up to an 8 out of 10. It can fluctuate within there, but it never goes away. Acute pain does go away. There are moments where you don't feel anything. Chronic pain can be caused and or worsened by stress and anxiety, which typically isn't seen with acute pain. I'm just looking in the chat now. I see Jennifer experiences pain daily. Some days are worse than others. Neuropathic pain and MS hug are my favorites. Ken says daily, chronic, and acute. That's true too. You can have both acute pain and chronic pain in different body parts, different areas. Rick says the past year has been has a very stiff neck. Yep, and that's a different type of pain. Been doing acupuncture, which helps some. Kimberly says, pain in the back of my legs wakes me up at night. Yes. Pam says, I have numbness and tingling in my arms and legs. You guys are calling out all of the perfect types of pain. Rick says, not sure if it's from MS. That is true too. Kimberly says, chronic but no injury. Right now it's been going on for 6 months. Yeah. Thank you all for sharing that. It's really helpful to hear where you're at and all the different types of pains that you guys are experiencing, because you are not alone, and I think this just goes to show that. So let's get into the different types of pain, and to be honest, there's a ton. I'm going to give you the most common. So we have a few slides on definitions, but there are more than just these. So one is allodynia. Allodynia is what is the word used to describe where the pain is, how do I want to phrase this? Where the pain that you are feeling is when a light touch feels painful. So if you just have, if you're experiencing in your hand, you could just lightly touch your hand, or maybe something like a hair tie grazes against your hand, but it feels painful, and it shouldn't. It could be a handshake. It could be socks, putting socks on. It's soft and light, but that could feel painful. So that is allodynia. Then we have paresthesia. This is a pretty common one in MS and not in MS. Paresthesia is this annoying, unusual sensation like tingling or numbness. It can be triggered by something, or it can happen spontaneously. In the case of MS, it could be triggered by MS or happen spontaneously. Paresthesia can also happen from things like pinched nerves in your neck or in your spine. So if you've ever heard of sciatica, that can be a form of paresthesia as well. Dysesthesia is different. Dysesthesia is a more intense and sometimes painful feeling, which happens spontaneously. So one of the biggest differences between paresthesia and dysesthesia is paresthesia, again, is that tingling, numbness. Usually when people are describing how your pain feels, if it's a paresthesia, they typically don't use the word painful or pain, whereas with dysesthesia, it's painful. And just to pause here to highlight the point that when you are talking to your neurologist, your physical therapist, anyone on your healthcare team about your pain, it is so helpful if you can be as specific as possible. Think of the words that you would use to describe your pain, as many words as possible. Think, and we'll talk a bit about this in later on here, but what is the intensity like? When does it happen? Because figuring out the type of pain is going to be important in your treatment plan. So again, these are things that we're listening for. Did you use the word pain? If so, paresthesia might be out, but dysesthesia might be in. Okay, let's keep moving on. So there's a few other types as well. Neuralgia. Neuralgia is another common one in MS as well as in non-MS. This one is intermittent, and it typically is a shock-like pain that follows a nerve path. The two most common ones in multiple sclerosis is trigeminal neuralgia. This is when it's following the nerve path of the facial nerve. And so it's this intense pain, usually on the side of your cheek, one side of your face, sometimes into your neck, but again, it's that facial nerve which follows this path. Intense pain here. And then Lhermitte's sign or Lhermitte's neuralgia is another one, and it typically occurs when you look down. When you look down, your spinal cord and your spinal nerves are all extended, they're getting pulled. And when that happens, you can experience this shock-like pain going down your spine. For some people, it just goes down to your shoulder blades. For some people, it goes all the way down to their butt. It goes anywhere in between. It's different for everyone, but very painful, shock-like symptoms from neuralgia. We then have optic neuritis. This typically, so optic means eye, and neuritis is inflammation in that optic nerve or Neuritis is inflammation in the nerve, in this case, optic, so eye, nerves. So this one is eye pain, and it typically worsens with movement. It's often explained as a dull ache, typically behind the eye. So again, this is when it's important to be very specific about your pain. What does it feel like? Is it sharp? Is it stabbing? Is it dull? In this case, it would be dull. And where's the location? Not just my eye. Does it feel like it's the side of my eye, the outside, the inside, the back? Get very specific. We also then have muscle spasm and spasticity. This spasticity is a form, or how do I want to phrase this? One form of spasticity is the MS hug. So for everyone saying that you experience the MS hug, that is a form of spasticity. And this often feels like a form of muscle tightness that doesn't let go. Spasm and spasticity are different. They can last for different amounts of time. For some people, their muscle is always spastic, and it might fluctuate with how much, but the spasticity is always there, whereas a spasm typically isn't always there. It will come and go. And then musculoskeletal pain. This, a few of you guys, and I'm looking in the chat, a few of you have said, Brenda said chronic pain in the knees and ankles. Perfect example. I think someone earlier said pain in the back of my legs. There was another one. Pain on the left side of my mid back all the way down to my legs. So this musculoskeletal is a type of pain that refers to our muscle and bone system. Whether you have MS or not, anyone can have musculoskeletal pain. This is most common, it's most commonly described from athletes or as we age. So knee pain, arthritis, that's a musculoskeletal type of pain. If you fell and you hurt your hip or your back or your shoulder or your neck, if you slept wrong and you had a kink in your neck, that can be a musculoskeletal pain. So oftentimes, musculoskeletal pain is not an MS pain, but I wanted to include it here because people with MS can still experience it. You're still human. You're not only going to experience MS symptoms just because you have MS. So again, this is the most common type of pain amongst all people with or without MS. And it can feel like a muscle soreness. It can feel like an injury, like you tweaked something, things of that sort. Before we go on, there is one other common if you have pain and then you treat it, how do you determine the status of the pain if the treatment gives you relief? Should you allow some level of the pain to stay so that you can judge what is going on? I like this question. I'm just trying to decide if I fully understand it before I answer. If you have pain and then you treat it, how do you determine the status of the pain if the treatment gives you relief? I think, and Tina, correct me if I'm wrong, but I think what the question is saying, if you get relief from the treatment, how do you know if the pain is actually going away or if it's just the treatment? And if that's the question, it's going to be dependent on if this is an acute pain or a chronic pain. If it's an acute pain, meaning comes and goes, then what your doctor would likely prescribe is lessening that treatment over time. Whereas if it's chronic pain, your treatment might stay the same, and this might be a 6-month plan that you're on this medication or a year-long plan that you're on this medication. It's obviously going to be different for every specific situation, but you would, if it's acute pain, you would know that the actual pain is lessening when you start tapering off or weaning off of that medication and the pain is less than it was before. Whereas with chronic, it might still be that same way, but you might not even get to notice that for 6 months or a year, however long that treatment plan is for you based on what you and your doctors decide. Kenneth says, before diagnosis, I had pain in my left trunk. Doctor thought it was shingles, but it didn't develop. Now numb in that area. Yes, so that's lots of different types of pain. Does optic neuritis include redness, soreness, and pain with eye movement? Optic neuritis does include pain with eye movement. That's one of the classic symptoms of optic neuritis in particular, because there are other optic and nerve pains that you can experience in your eye. Pain with movement is very specific to optic neuritis. I'm not sure about redness. Soreness, I would imagine that that would be pretty common. I was diagnosed with episcleritis multiple times, and way before being diagnosed with MS, I'm wondering if I could have been misdiagnosed and whether I was really experiencing optic neuritis. Yeah, I'm not sure. I will say optic neuritis is typically one of the most common first symptoms of multiple sclerosis. I've talked to lots of neurologists about this, and the general consensus is that it's not necessarily because that this symptom occurs more often. It's that we take our vision more seriously. So if we have a vision symptom, we're going to the doctor. Whereas if we have numbness in our leg, that's something that we can maybe deal with on our own for a couple weeks, couple months, and then maybe it goes away if you're starting with relapsing MS and you never went to the doctor. So with optic neuritis, it is a common first symptom of diagnosis, but it could just be because we take our eyes seriously and we don't mess around with any symptoms that we're experiencing there. Rick, I felt bruised behind the eye, went to the eye doc and he gave me meds for a week and it went away. Yeah. And you know, sometimes, and we're about to get into treatments, but sometimes even MS symptom, even MS, even pain that's caused from MS could just be due to temporary increase in inflammation. And so if you're able to get a medication that reduces the inflammation, that pain can go away. And Milani's, I see your comments now. How do you treat chronic pain? Good question. So we're about to get into that. Let me go back to sharing my slides. Okay, so before we get to how we treat, let's go a little bit further into the types. And these are really great examples of words you might use to share what your pain is feeling like. So burning, pins and needles, numbness, tingling, crawling, like bugs crawling, tightness, electrical shock, stabbing, shooting or radiating, MS hug, phantom pain. One that's not on here is dull ache. That absolutely counts. There's so many different words, but again, just getting really specific on what you are experiencing can help you lead to a quicker treatment, we'll say. So why is this happening, specifically in multiple sclerosis? So this doesn't necessarily apply to the musculoskeletal type pain, but when you're experiencing any of those types of pain from MS, 99.9% of the time, it's due to damage in the spinal cord. It's not because there's actual damage to that part of your body, and then you're feeling that sensation of pain or numbness, tingling, whatever it is. The damage is in the nerve that leads to the spinal cord. So there is miscommunication. The brain can't, so there's miscommunication between the brain and then the body part that's feeling it. There is a neural pathway, a nerve pathway that leads from your brain to every different body part that we have. And so when your body part is feeling a sensation, it could be light touch, it could be tingling or something, it could be anything, it could be a pen, holding a pen. When your body part feels something, that neural pathway that is supposed to tell your brain, this is a pen, this is not hurting me, it gets lost. That signal gets lost, it gets misinterpreted, and your brain doesn't know what that is. And so it's trying to associate it with something that your body knows how it feels. So you might be feeling the pen cap, which your brain might feel as sharp, because there's a sharper edge to a pen cap. So while it's not actually painful, your brain can't interpret what is actually happening, and it knows from previous experiences what sharp feels like. So it's going to tell you that this is sharp, and that's going to really hurt to hold on to that pen. So it's, again, it's not necessarily that there's actual damage or injury to the body part that you're feeling this. It's that miscommunication between the spinal cord, the brain, and the body part that you're experiencing this. Now, of course, if you're experiencing something that is due to an injury or a pulled muscle, that is a different thing. And the reason that you're feeling that is the injury or the pulled muscle. There's an actual reason. But when we're talking about MS, this is the reason. Trigeminal neuralgia pain, says Jean. Yes, absolutely. Plaque on trigeminal nerves. Pain in your head, not on your body parts. Yeah, it is kind of like pain in your head, but it's not that you're going crazy. Like, your brain is literally interpreting that information incorrectly, but it doesn't feel incorrect. It feels like, I'm telling you, there's something sharp on my hand, you know. So it doesn't, I don't like to use the word that it's in your head. It is, but it's not that it's not real in a sense. It's just that miscommunication. It's almost like, you know, the game, oh my gosh, I'm gonna forget what the game is called. The game where you sit in a big group of people and you whisper something to the person next to you, and that person whispers it to the next person and the next person, and you get back all the way to that first person and you see, what message did you receive? What's the name of that? If anyone can remember. Telephone, yes, thank you. Mayte, thank you. It's oftentimes when you get back to that person who said it, it is not the same message. That's basically what this is like. It started off as one thing. It's, you're holding the pen, but by the time it gets back to your neural pathways in your brain, it doesn't understand that. It's a completely different message. That's kind of what this is like. My largest lesions are on my spinal cord. A couple of times since my diagnosis, I've developed new lesions. It's been on my spine. Yeah. So are you saying that there may be nothing wrong with the painful area itself, and the problem might be, yes, to the neural pathway to that area? Yes, exactly. A few people knew the name telephone. Thank you for that. Oh, it's also called Whisper Down the Lane. Very cool. Okay, so implications. So what does this mean for you? When your brain is not receiving the right message from the neural pathways, oftentimes that can result in numbness in your feet. And when you have numbness in your feet, that makes walking more challenging. If you can't feel your shoes or the ground as much as normal, as much as what you used to, that is giving your brain mixed signals. Your brain doesn't know where your foot is in place. You might trip more because you don't know that you need to lift your foot higher. You might cross your leg over more because your brain can't tell where straight is. So it can make balance more challenging. Anything with walking can be more challenging if you have numbness or decreased sensation in your feet. If you have the MS hug, that is another thing. You know, an MS hug is a perfect example of what we were just talking about. It feels like intense pain and squeezing around your torso. For some people, it goes up to their neck. No one's actually squeezing you. It's a form of tightness and spasticity. So it is slightly different in that your muscles, they're called the intercostal muscles between your ribs, those could be tightening, and that's what feels like someone squeezing you. But your brain is trying to associate it with an experience that you've had before or what you know it feels like. We all know what a really tight hug feels like. In this case, it's very painful, but your brain's trying to make sense of it. And that can cause difficulty breathing, difficulty moving. For pins and needles in your hands, this can cause weakness in your hands. It can cause you to drop items. I have so many patients that I work with, and they drop their coffee mugs all the time, or they're holding yogurt and it falls through their hands. So pins and needles in hands, very similar to numbness in your feet, it will affect your daily activities with your hands. Hot or cold, this one is pretty tricky because essentially your body cannot regulate itself so it doesn't know if you're getting too hot or if you're getting too cold. And if you're using a heating pack because you have an injury, it could result in a burn. Or if you're using a cold pack because of an injury, it could result in a burn from the coldness. So if you have a sensitivity or an inability to sense temperature as much as normal, be very mindful of when you're using hot packs or cold packs. Another thing that I want to share, and then we'll get into treatments, is that I just think this is helpful information to know. We have lots of different types of nerves. So for every nerve that we have, for every body part, we have two nerves that goes there. One is a motor nerve, and that's muscle stuff. It's strength, it's balance, it's mobility. And then we have a separate nerve that goes there, and that's a sensory nerve. That's what we feel in that area. And what we're talking about today is all that sensory stuff. And when it comes to sensory, we have different thicknesses of nerves that go up to our brain, and each nerve senses something different. So for example, the pain nerve is going to be a very thin nerve, and the thinner the nerve, the quicker it gets up to your brain. It's just faster. So the thinner the nerve, you're going to feel that first. So pain is a pretty thin nerve. What is thinner than pain is kind of like pins and needles. So you'll feel that pretty quick. That is one reason why electrical stimulation can actually be used to reduce pain, because the pain nerve is thicker than the pins and needles, that poking sensation that you get from electrical stimulation. So our brain feels that first. So that gets to the brain first, and we essentially don't feel the other neural pathways and information that those are bringing in, because we're already feeling one sensation. So different sensations, different thicknesses. So you might be feeling lots of different types of pain. There might be lots of things going on, but your brain is really only focusing on one, and it's going to focus on that one that is getting to your brain fastest. Okay, so now what you are probably all waiting for is the treatments. So there's fortunately lots of different things that we can do for pain. For medications, there's so many different options. These are just the most common, but I would highly recommend you talk to your neurologist or whichever doctor you're working with on pain management to see what would be best for you in your specific type of pain. Botox is something that can be very common for pain related to spasticity, or even for things like migraines can be a type of pain. Botox has been known to be very helpful for migraines. Botox essentially relaxes the muscles. So any type of pain that you're feeling from tight muscles, Botox could help with. You might be feeling paresthesias or dysesthesias from a really tight muscle that's pinching the nerve. Botox might be a good option for that. Another option is pulsed magnetic field. This is a type of magnetic treatment that works to wake up, if you will, the neural pathways. So we talked earlier about how that neural pathway is just miscommunicating. The goal with this type of treatment is to get it to stop miscommunicating and understand what's really going on and delivering the appropriate message. Baclofen is another one for pain management, especially when you have tight muscles like spasticity, spasms even. Gabapentin is one of the most common ones for generalized pain. Amitriptyline, duloxetine, pregabalin, antidepressants. There's a lot. Again, these are just some of the most common ones. I do just want to make a point on the last ones. I mentioned earlier that chronic pain and all the pain types that we discussed can either be acute or chronic. Chronic pain is the one that is worsened by stress and anxiety. So antidepressants tend to be at least one component of the medication list for chronic pain, especially if you are experiencing depression, anxiety, stress, anything of that sort. There are no medications at this time to relieve numbness. However, with that said, sometimes numbness will improve if the reason for the numbness is tight muscles. maybe you're doing Botox or baclofen. But if the numbness is specifically due to MS, not another musculoskeletal or muscular reason, there's no medications for that yet, but there are other things that you can do. I see a comment that says, sometimes I can walk better in bare feet. Yep. Do these types of pain have anything to do with what is called referent pain? Not necessarily. Referent pain is when it's referred pain. So referred pain is when you're experiencing pain in a specific body part, but it's not actually that body part that's causing the issue. Let me see if I can quickly pull up. There's a really cool diagram that shows where referred pain might be appearing for you. I'm gonna see if I can, I don't wanna waste too much time, but I wanna see if I can quickly find it. Okay, so this is a graphic for referred pain. And so essentially what this is showing is that if you are having right, like trapezius pain, so shoulder, neck, kind of between the shoulder and neck, that could be an actual injury there, or it could actually be indicative of something going on with your liver. Similarly, liver also goes to your chest, like your sternum area. Heart, this will resemble, you know, when we're experiencing a heart attack, where we might feel symptoms, but even if it's not a heart attack, your heart might refer to the left side of your chest, as well as down the left side of your arm all the way to your pinky, as well as the back, so like the between your shoulder blades. The small intestine could be right in the middle of your stomach. Appendix, of course, we tend to all know what that one is. The right ureter could go down the leg. Kidney pain could be right above your butt area, like your very low back. Bladder could be actually near your butt on either side. So I think this is important to know. It usually, I will say most times, this chart isn't really considered unless you've ruled out the other known things and areas. So usually your doctors are going to start looking at, like if you're experiencing pain right here, they're typically not going to think liver first, unless it's combined with rapid weight loss or weight gain, you're not sleeping at night. Those are things that tend, and it's not related to MS, those are things that tend to be more serious, so they might jump to this list faster. But for the most part, they're going to first start looking at what's going on with your muscles, what's going on with your MS, and see if they can treat that first. But this is referred pain, so it is good to discuss that. All over pain normally, but recently right arm intense, different kinds of burning and stabbing, and right leg weakness. Yeah, so burning and stabbing, again, there's lots of different reasons, and that's why you want to talk to your doctors about exactly what are those words. Does anything make it better or worse? What is the intensity level? Does it fluctuate? Those are going to be important things to figuring out why it might be happening, and then that might determine some of these treatments that we're going into. Okay, so beyond medications, these are some other options. So occupational therapy is the type of therapy that focuses a lot on splinting. So specifically for your hands or maybe even your foot, if you have a lot of pain in your hands and a lot of spasticity, so your hand is closed, they might get a splint for you that opens your hand to help improve your function and reduce pain. Or exercises, they might give you exercises specifically for writing or buttoning your shirts if you have pain or weakness with fine motor skills, putting earrings in. Oh, I should have worn my Halloween earrings. Putting earrings in, clasping shirts, things like that, zipping up something. Handling money. Occupational therapists are typically who you work with. Physical therapists can also help with those things, but they tend to focus more on still strengthening exercises, balance, things for mobility. So walking, stair climbing, stretching. If several people mentioned really tight muscles or spasticity, That's something that physical therapy is going to help with. Electrical stimulation, desensitization. I want to take a moment to talk about this because I find that so many people have not heard of desensitization. And if you have an MS specific numbness, meaning it's not due to a pinched nerve or anything like that, it's just due to this miscommunication in the neural pathway, one of the best things that you can do is desensitization. As we talked about earlier, there's no medication for it, but desensitization is, let me just stop sharing my screen. Desensitization is when you desensitize your body part. So whether it's a hand, a foot, whatever it might be. For this particular case, I'm going to go with my hand because you guys can clearly see my hand. If my hand is very sensitive to light touch, maybe it's that allodynia, and this is very painful, then essentially, and this is going to sound crazy at first, but what you want to do is grab something that brings out that sensation. If it's really, really painful, try to find something else. So if this is just so painful, then maybe I'd find a cotton ball or a tissue, just something that's even softer and lighter than this. But let's say it's not super, super painful. It does just bring on the pain or the numbness, the tingling, burning, pins and needles. Then I would grab this and I would purposely rub it over the area that is feeling that sensation. You can just rub, you can tap, there's no right or wrong, just touch the area for several minutes. Typically what you'll notice is within I would say 3 to 10 or 15 minutes, you'll notice that the sensation is starting to lessen. That's what desensitization is. You're basically provoking it so that your brain is realizing, oh, okay, wait, this is actually okay. It's just a hair tie. I'm not in danger. This is not a red flag. I'm okay. And that pain starts to lessen as soon as your brain starts to understand that. Over time, this no longer is really going to provoke that symptom anymore, but other things will. At that time, we grab something else. This happens to be a pen that's nearby. The edges are kind of rough compared to this. So we have two options. If this is too intense, at first, I can use the smooth side. And same thing, you're going to do that for 3 to 15 minutes or so. You could do it 3 times a day if you need to. And sometimes within the same session, it starts to lessen and you can drop it and move on to something else. Other times it might take a few days or a week or so. But the goal is do it long enough to the point where it starts to lessen. What that is indicative of is your brain understanding, okay, I was wrong. It's not a tiger eating my hand. It is a pen. I'm okay. And then you'd move on to something else. So that's what desensitization is. One of my favorite things to do if it's in your hands or feet is getting dried rice and maybe even dried lentils, putting it in a big Ziploc bag, and then put your hand in there. Just move it all around. Pick up the rice, lower it, roll your hand. Rice has sharp edges that will not actually hurt you, and soft, round, dull edges. So you're getting 2 different types of sensation with that. Same with the lentils. There's sharpness around the edge, and then softness on the top and bottom. So again, 2 different sensations. That can be really great. Put your foot in there, your hand. Quick story about that. I had a patient come in once. It was the end of the day, 7 p.m. And normally she comes in at that time and we're able to do walking exercises, strengthening exercises, balance exercises. But that day she came in with so much burning pain in both of her legs from her toes all the way up to her knees. And it was just so intense. She literally came in tears. So the first thing that we did was we grabbed our dried rice. We had 2 buckets full. She put her feet in and she just was moving them around. I also was lifting the rice and putting it on her shins and her calves. And we just stayed there for the full 30-minute session. And about 10 minutes in, she noticed that the pain was no longer stemming from her toes all the way up to her knees. It was about half that distance. And then we kept going, and by the end of the session, it was still there, but it was not the whole distance, and it was much, much less. And again, it's just trying to wake up your brain like, hey, wake up, here's what's actually happening. So in her case, within the same session, it dramatically improved. As I mentioned, sometimes it can take even longer, but that's what desensitization is. It can feel really tricky because you do need to provoke the symptom. You need to bring it on at first, which often is not comfortable. Can you comment on hands-on treatments such as massage and acupuncture for relief of pain and discomfort? How and what should you communicate to your practitioner so they know how best to treat you? So same thing as what we've been saying this whole time. So regardless of what practitioner you're saying, it could be a physical therapist, neurologist, occupational therapist, acupuncturist, massage therapist, anyone, you're going to tell them the same thing. What does your pain feel like? How would you describe it? Use as many words as possible. What intensity is it? Out of 0 to 10. Does it fluctuate? And if so, between what? Between 4 out of a 10 and a 7, 1 and a 10? Does anything make it better? Does anything make it worse? All of these things can be helpful in them determining what is going to be helpful. When it comes to hands-on treatments like massage or acupuncture, oftentimes that is going to be the most effective for anything that's caused from muscle spasms, tight muscles, spasticity, muscle injury. So not necessarily the MS specific ones, but all those other ones that are related to muscles, cupping, dry needling. There's a bunch of different examples of those types of treatments. I have Intensity Twin Stim 3 at home. What is the best way for me to use that device? Where and how should I place the sensors? How long should each session be? Any other tips? So this is such a good question. Unfortunately, I don't have an answer for you because I don't have all of your history and information, so I can't provide that advice. But I will say, whoever gave, oh, I guess it sounds like you purchased it at home. I would work with an in-person physical therapist, even if it's just for one session, and have them help you figure that out, because anything with electrical stimulation is going to be very specific for each individual. The best way to use it, there's usually lots of different settings. You're going to want to choose a specific setting based on the pain that you're feeling. Where should you place the sensors? Super specific to where your pain is. Sometimes it's right on the area of pain. Sometimes it's above and below it or on either side of it. So that's something that you play around with. How long should each session be? It's dependent on how long you can tolerate it, especially when first starting out. Sometimes your doctor might say only up to 5 minutes. Sometimes they say up to 20 or 30 minutes. So again, really specific on your specific situation. So all very good and valid questions, but I'm not the best person to give you that specific guidance. For phantom itching, I put ice on the area. That's a really good one. That's a good example of how that itching feeling is on a larger, slower nerve than coldness. So you're going to feel that coldness first, and it can make that itching symptom feel less because it's not getting to your brain as quickly as that coldness. Can this be used for MS hug? If you're talking about the desensitization, you could try it. I actually haven't had anyone tell me if it worked or not for the MS hug. You could try it. It's not going to hurt you. It's a very, it's a hair tie or whatever it is that you're using. So there's no negative side effects to it. So I would absolutely give it a go. I'm a big fan of trial and error. But with MS hug, everyone is so different. For some people, light movement feels better because it's when the muscles are spastic. So lightly moving, it could be something like this, or maybe lightly tipping one way or the other can loosen up some of those muscles. For other people, that makes it worse. So again, it's going to be different based on what you feel makes it better or worse. I got the stim device from my PT. Perfect. So they know your full situation. They should definitely be the one to tell you that. If they don't, you might want to see a different physical therapist. That's definitely something that you should be able to bring it in with you and say, put this on me and tell me what to do so I can do it at home. Exercise, of course, strengthening, balance, stretching. There's so many different things that you can do for exercise. It could be in a physical therapy clinic. It could be seated at home. It could be in bed at home. It could be in a pool. It could be so many different areas, whatever is feasible for you and feels like it's helping. It's good to be aware of what makes it better or worse. It could even just be fixing your posture. Does that make anything better? Massage, as we talked a little bit about, there's so many different types of massages. There's trigger point massage, there's soft tissue massage, there's deep tissue massage. Every different type of massage can have a different effect. Acupuncture, dry needling, cupping, gosh, I feel like I'm forgetting a bunch, but those, more hands-on treatments can be really great for any of these types of pain. Again, heat and cold, as long as you're not sensitive or unaware of how hot or how cold something is getting. Compression sleeves is something that can be helpful. That's something that several of my patients and members have told me has helped them, is wearing compression sleeves on their hands or their feet all the way up to their knee, for some all the way up to their thigh. So lots of different options. Again, it's a lot of trial and error, trying one thing, sticking with that for, depending on what it is, anywhere from a few weeks to a month or two. If that doesn't feel like it's helping, try something else. Kenneth is saying, with my TENS unit, I always am cautious on the settings in areas with reduced or confused sensitivity. Yeah, very good point. If you're having lack of sensation, or numbness, anything that's abnormal sensation, you're going to want to be very conservative with the TENS unit, the electrical stimulation unit, because it might actually be really intense, but you're just not noticing it, and then that can result in discomfort after the fact as well. I once worked with a hand therapist post-hand surgery. The therapist had me place my hand in a box with small flying particles. Yes. Perhaps corn husk, something like that. Does this apparatus sound familiar? It does. Oh my gosh, what is that called? We learned about that in physical therapy school. But essentially what we learned about it is that the newer research now shows that it's not effective, and so it's not used in many clinics anymore. With that said, it is a form of desensitization. That's not what it was used for back in the day, which is why it was shown that it wasn't really effective. But if your clinic, I'm forgetting what that's called, but if your clinic does have that, it could be a good desensitization tool. Okay, just a few slides left here. Treatments also, reduce stress, so much easier said than done. I recommend things that feel easy to you. Maybe it's taking 5 deep breaths. Excuse me. For me, I really love coloring in a coloring book. If you're able to hold on to colored pencils, or you could get weighted colored pencils, or beef it up, like put some things around it so that it's a much thicker colored pencil. Coloring book, that really helps me with reducing stress, just kind of getting out of my own head. Reading a book, it could be something different, meditation, praying, whatever works for you, but something to reduce stress. Even if you still have stress afterwards, that's fine. But if your stress level was a 7 out of a 10, the goal is, can we get it to be a 6? Don't focus on removing the stress, just can we lessen it? Resting. And what I would like to add here is resting guilt-free. I don't know about you, but for myself and the majority of people, when we are resting and we're focusing on the fact that we should or want to be doing XYZ instead, when you're done resting, you don't feel restful. You don't feel as rested because your brain was just focusing on, well, I should be exercising, or I have to now cancel this plan, or say, if possible, allowing yourself to rest. Don't feel guilty about that. Resting is productive. Our body literally needs rest to function. And some bodies need more rest than others, and that's fine. That we should just be able to do that without guilting ourselves for not being as active as what we used to be, or this person next to us. Distraction or focus elsewhere. So one thing with pain that sometimes can be helpful is focusing elsewhere. One tip I got from someone once was she was experiencing really bad pain in her knees, and the more she focused on it, the worse it was. So, and she was in a meeting, on a Zoom meeting. And so instead of focusing on her knees, she started focusing on what was around her. So I have a light right behind the camera. So I could look at the light and see, where is the light brightest? Where is it dimmest? What does the lamp look like? Like what other designs do I see? Do I see any shadows? And you get really specific on what that thing looks like. It could be a picture, it could be anything, but focusing elsewhere, and her pain immediately started to lessen. Focus on steady breathing. Belly breathing is a technique that I like to use mostly because it requires so much focus and concentration that you can't really focus on belly breathing and the area of pain at the same time. But also belly breathing has been a known fact in research, as a known exercise in research, to activate the vagus nerve, which promotes relaxation. Belly breathing is when you focus on inhaling through your nose, and when you're doing that, your belly expands out, and then when you exhale through your mouth, your belly comes in. So you inhale through your nose, belly expands. Exhale through your mouth, belly collapses. And for a lot of us, that's the opposite of how we breathe. When we breathe in is when our belly comes in, and when we exhale, we relax and it goes out. So for a lot of us, it's the opposite. It can take a lot of training to get that to feel normal, but that's a type of treatment as well. I believe this is the last slide. So other things that you can do is try to figure out, if possible, what are your triggers? Is it the temperature outside? Is it a hot shower? Is it stress? Is it the coldness outside? Is it seasonal changes, transitioning from cold to hot or hot to cold? Is it exercise? Not all exercises are created equal. So, excuse me. Maybe there's a form of exercise that is actually triggering you, or you're just doing it too intensely and it didn't used to be too intense, but now it is. What is that exercise? Sexual issues, anything with bowel, bladder, tightness in your inner thighs, spasticity in your pelvic floor, weakness in your pelvic floor. Does that make things better or worse? Is it a trigger for you? Things that you use, pen, cup, fork, hair ties, something that you are using or touching throughout your day, a trigger for your symptom. Chairs that you sit in, your posture, the position that you're sleeping in, all of these things are going to be really good things to mention to the provider that you are working with to help you feel better. Okay. I do see some comments. These are some other places you can reach me. We, of course, do these every single month with MS Views and News. And again, a huge thank you to our supporter, Viatris, for supporting these. So you can see me next month. We'll have a different topic. We are the second Monday of every month at 4 p.m. Eastern Time. You can also go to my website, missinglink.com. I have a Facebook group, Instagram, podcast, YouTube, and then I also have a book called The Missing Link as well, and my online wellness program also called The Missing Link. But I'm gonna try to wrap up these questions. Let's see, I use Back Buddy for some pain and percussion in areas of spasticity. Yeah, that's a great option. VR headset, 3D puzzles. Ooh, I like that. 3D puzzles, I've never done a 3D puzzle. That sounds really fun. The VR helps to distract from stress or pain. I've never done virtual reality, but that does sound like a really cool technique to use. Thank you so much for this session. Earlier today, I had a Zoom yoga class on spasticity with your mom through the Maressa Center. That's awesome. We did some gentle stretching and breathing. It was a very soothing and helpful session. So I guess this is a Hawley Monday. That's awesome, Tina. Deb, feel well. Thank you, thank you. Again, going on 2 weeks of this cold. Hopefully it'll go away soon. Great webinar. Thanks for your social media links. Yes, you're very welcome. So I will let you guys go. Thank you so much for tuning in. I really, really appreciate you chatting with me. I know that you can see me and I cannot see you, but it's really helpful to get your feedback and your questions and your thoughts and things that are working for you throughout. So thank you to everyone who shared, especially on a topic like this. It can be really easy to either feel like you are alone in experiencing this or not know that something isn't normal. It sounds silly, but if you're used to feeling a certain thing, a certain type of pain for years, you might think it's normal. And to hear that it's not can be eye-opening so that you talk to someone about it. I experienced daily headaches for about 4 years, and I thought it was normal. I didn't tell anyone, not my doctors, not my friends and family, because I just assumed everyone has headaches daily. And it wasn't until I was in physical therapy school, and my friend who was sitting beside me, I asked her if she had any aspirin or something because I had a headache. And she's like, no, I haven't had a headache in years. And my mind was blown. I was like, what? I literally have them every single day. Like, what do you mean you don't have them every day? And then it was at that point that I started telling my doctors and working on it. And fortunately, I no longer have headaches, which is great. One of the reasons for me was my posture. And I was in school at that time, grad school, immediately followed by physical therapy school. It was a lot of sitting like this, and my neck was at this awkward angle that can cause a very specific type of headache called cervicogenic headache. I also rode my bike to school. So again, I'm forward, but my head is up. I was in this position a lot. So it was a lot of stretching, releasing, getting muscles to work the way that they should. So you don't know if you didn't feel like something was abnormal and now you do. I'm glad. It's worth talking to your providers about it. Awesome. Thanks so much for tuning in. Thanks for participating. I will see you next month. Have a good one, everyone.